can be more than just a stuffy nose. Each year, nearly 1 in 7 people are diagnosed with a sinus infection. Many doctors might give you antibiotics for the infection, but now new guidelines may end that practice. Experts say it's for your own good.
Sarah Brodsky gets irritating, painful sinus infections all the time.
I was constantly stuffed up, felt pressure in my face, headaches that would even be in the back of my head.
Sinusitis is an inflammation of the sinuses that occurs with a viral, bacterial, or fungal infection. The cavities around the sinuses become inflamed and swollen, which interferes with drainage and causes mucus to build up. But while sinus infections account for the 5th leading reason that doctors prescribe antibiotics, the Infectious Diseases Society of America today says they're advising doctors not to prescribe them for most cases.
Most people don't necessarily need antibiotics. They need to open their sinuses.
Experts say 98% of sinus infections are caused by viruses, which are not helped by antibiotics. And worse, when used inappropriately, antibiotics foster the development of drug-resistant superbugs. Ear, nose, and throat specialist Dr. Babak Larian says even when it's bacterial, antibiotics may not help all symptoms.
You can use antibiotics, but antibiotics in and of themselves don't open the sinus. They just kill the bacteria that's in the fluid.
The new guidelines also say people with sinus infections should avoid decongestants and antihistamines. They can make things worse.
The downside of Benadryl and antihistamines during a time where you have mucus buildup is they make the mucus thicker, so it has a harder time getting out of the sinus.
Instead, prescription nasal steroids can help ease symptoms. Experts also recommend using saline nasal irrigation for relief. Also take acetaminophen for sinus pain and drink plenty of fluids. So if you find yourself leaving the doctor's office without a prescription, don't feel slighted.
The guidelines are designed for primary care doctors. Dr. Larian agrees with antihistamines that it can make symptoms worse, but he says if caught early, decongestants can help with sinus draining. And if a person is otherwise healthy, he or she can usually get better without the use of antibiotics.